All right. Thank you so much. Welcome to another episode of the Love Hope Lyme podcast. My name is Fred Diamond. Of course, I'm the host of the Love Hope Lyme podcast. I'm also the author of Love Hope Lyme, what family members, partners, and friends who love a chronic Lyme survivor need to know. The book is available on Amazon. Bruce, I've made the PDF of the book free for chronic Lyme survivors since it was published. And I've given out well over 1,000 PDFs of the book. If you'd like a complimentary copy and you're a Lyme survivor, you can reach out to me via Facebook. You can reach out to me via LinkedIn. I'm pretty easy to find all over the internet. I'd be happy to send you a copy. And if you'd like some signed copies of the book, Love Hope Lyme, reach out to me as well. And Bruce, I send people a dozen copies with signed copies that they give out to family members and friends. And I'm always happy to do that. You can go to freddiamond.com, www.freddiamond.com. Or again, you could find me on Facebook. And Bruce, there's also people who find me on LinkedIn. I spend a lot of time up there as well. And, when I published the book, Love Hope Lyme, one thing that I didn't know when I was doing all the research, I didn't understand the challenges that were happening with this disease with government organizations and with professional associations of infectious disease doctors and other types of entities like that. And I didn't really understand the history that a lot of Lyme survivors go through to prove to their doctors that, they have this particular disease. And I've featured some organizations on the Love Hope Lyme podcast, like Bonnie Crater from the Center for Lyme Action. I'm excited today to talk to Bruce Fries. And Bruce is a classic example of someone who is a Lyme survivor, but has also devoted a lot of energy to advocacy. And we're going to be talking today about why it's important to be a Lyme advocate if you're a Lyme survivor or if you're a family member or friend or parent of somebody with Lyme disease. There's so much that needs to happen, I've learned, to educate important people in government, people in professional associations, people in local government. If you're in many states where there's tick problems, people need to be educated. And I've met so many people who are doing that. So Bruce, I'm excited to have you here. Why don't you give a little bit of a short background on who you are and what you do, and then we're going to go through some of the specific things that you've done, Bruce Fries, to make an impact and things that you're continuing to do today. We're doing today's interview in the spring of 2024. If you're listening in the future, and by the way, if you're listening to today's show on Apple Podcasts, thank you so much. Go give us a 5-star review. We would greatly appreciate it. If you're watching on YouTube, give us a thumbs up, subscribe to the channel, give us a comment. We would greatly appreciate that. And if you've read the book, Love Hope Lyme, go to Amazon, give us a review as well. All right, Bruce, I'm happy to have you here. I'm happy to talk to you. Give us a little bit about your background.
Okay, well, my background as a Lyme patient began in 2007 with swollen knees, migratory joint pain. I went to an orthopedic doctor, put me on physical therapy and crutches. And it was 2 years before I finally got diagnosed and treated. And as I learned more about Lyme disease and some of the controversies, I got motivated to do something to help address, especially the need for better diagnosis and treatment. And I was especially concerned about the IDSA, the Infectious Diseases Society of America guidelines for diagnosis and treatment of Lyme disease, which have a very narrow definition of Lyme disease, which restricts access to care and denies treatment to a lot of patients with chronic Lyme disease. So the more I learned, the more outraged I became, and I wanted to do something about it. And my personal experience of marginalization and gaslighting was in a 2013 visit with an IDSA physician, and I mentioned a prior diagnosis of Lyme disease, and the first thing out of her mouth was, "I'm not going to give you antibiotics." It's like, wait a minute, she's treating me like a junkie, and I didn't even ask for anything. So that's how I got motivated. My initial focus was on working with the Mayday Project, doing publicity to raise awareness about Lyme disease and these issues with the guidelines. And one of the most, the nicest compliments I received was from a patient that said this advocacy, and not just the advocacy, we were speaking out, fighting back, but it provided hope and inspiration. And I think that's part of the healing process. So my background includes a lot of project management, publicity, sales, and marketing. And I apply those skills to advocacy using things like press releases, media interviews, even television advertising to raise awareness. And one of my goals is to make a difference, to do things that have a measurable difference and also have fun and empower other patients and advocates to become part of the process. So a lot of the campaigns included elements like petitions and mass actions where patients could participate and feel empowered and be part of the success. And I believe that hope and inspiration and empowerment are a key part of the healing process for patients with chronic diseases. And that helped me in my own healing, because the more I helped other people through advocacy, the better I felt, the more energy I had. So it, the energy sort of flowed both ways. So that's how I got started. And, it's been 10 years now, and I'm still at it. And we've had a lot of nice wins in terms of major media coverage from publications like Medscape Medical News, a lot of work with Congress, raising awareness through visits to Capitol Hill. And that's an example of where other advocates can participate in. An example, the Center for Lyme Action, their annual fly-in. And so I highly recommend any other patient or advocate participate in any of those congressional advocacy events, because you can really make a difference by showing up and speaking out and generating awareness with Congress, where it really makes a difference.
So you spoke about the IDSA. So talk a little more about that, the Infectious Disease Society of America. Talk about why it's a problem for people listening today. Again, you mentioned you went to an infectious disease doctor. If I have chronic Lyme, or if I have Lyme disease, why is it a problem that the guidelines are what they are?
Well, the guidelines have a very narrow definition of Lyme disease, which happens to be tied closely to patents that the guidelines authors have on vaccines and diagnostic tests. So there's a financial conflict of interest to maintain the status quo and not change the guidelines. The guidelines also deny that chronic Lyme exists, and they limit treatment to 2 to 4 weeks of antibiotics for most cases, and they don't even account for when Lyme becomes entrenched because of late diagnosis and treatment, that 2 to 4 weeks of antibiotics is not enough. And additionally, these guidelines are relied on by a lot of insurance companies to determine coverage. So not only do they lead to misdiagnosis of many patients with Lyme disease, but they also lead to financial hardship, because a lot of the treatment with Lyme literate doctors is it's all out-of-pocket expenses.
One of the interesting things that you just mentioned as well is because the guidelines are so narrow, one of the reasons why I wrote my book, Love, Hope, Lyme, is because the definition is so narrow. Some people don't believe that Lyme gets to the chronic stage for a whole bunch of different reasons. And if you're in a relationship with somebody, either as a family member or partner or a friend, and you see these very thin guidelines published on the internet, right, then you're going to automatically disbelieve that they actually have something that is really causing you all this ongoing pain.
And one of the things that's particularly outrageous is we have better guidelines by ILADS, and these guidelines are ignored and not widely distributed, but they're more reasonable, that where the treatment is determined based on clinical response, not arbitrary numbers like 2 to 4 weeks of antibiotics. And what compounds the issue of it just having bad guidelines is harmful enough, but when you have organizations like CDC that endorse and promote the guidelines, it compounds the problem because that gives it sort of a gold stamp of approval. And one of my focuses as an advocacy person was to address this issue because essentially CDC is extending preferential treatment to the IDSA guidelines by endorsing and promoting them while omitting any mention of competing guidelines from ILADS. And it's even worse because the CDC officials that extend the preferential treatment and even defend it are members of IDSA, the organization receiving the preferential treatment.
Yeah, actually, for people, we've had the co-director Lindsay Keys of the Quiet Epidemic on the Love Hope Line podcast. If anybody wants some more information on the history of this and some of the background that Bruce alluded to, I highly recommend that you view the Quiet Epidemic. It's available streaming in many places. Let's talk about congressional advocacy. We both mentioned Center for Lyme Action, the CLA. Bonnie Crater and Jeff Crater both run that. They do the virtual fly-in, which has continued to raise the elevation of Lyme awareness to our elected officials. I participated this year in 2024. I'm based in Virginia, and I got to speak to representatives from my two senators' offices, and there was a lot of people on the call, and there was very opening listening. Talk a little bit about why it's important for Congress to be updated on the challenge that is facing Lyme survivors.
Well, the job of members of Congress is to serve their constituents, and a lot of their constituents are suffering a lot from Lyme disease. And the more they're made aware, and numbers count, the more people that show up in these meetings, the more attention Congress gets, and the more funding that's going to be allocated, and the better chance of getting legislation like for the HHS tick-borne disease working group passed. And early in my career as an advocacy leader, I organized the Call on Congress campaign that resulted in close to 5,000 calls to Congress over a 2-day period in 2016, calling for decisive action to address the epidemic of Lyme disease. And this is an example where patients and advocates can, make the calls, or sometimes it might be a petition or some sort of action they can take, attending Center for Lyme Action event that really gives them a chance to make a difference and be part of the success. Now, early on, before Center for Lyme Action, I initiated a campaign that resulted in a $2 million increase for CDC's Lyme program. And now Center for Lyme Action does such an amazing job. I just work with them because they've raised increased funding by well over $100 million over the last couple of years. They do amazing work. So
a lot of people listening here who are Lyme survivors get triggered by CDC, the Centers for Disease Control, because of what they publish based on IDSA guidelines, what you just said. But the reality is, not the reality, but another reality is that CDC, they do play a role in some degree of tracking the number of Lyme people who contract Lyme, and they do a lot of measurement. There are people within CDC who are very committed to helping the Lyme survivor community get what they need. It's just it's an uphill battle for a lot of the reasons that we just said. I know you recently, there's been some work with a vaccine coming out, and I don't want to get into the history of the vaccine. Again, people can go watch The Quiet Epidemic to understand that, but there's some work being done to bring new vaccines or a new vaccine to the marketplace. And I know that you went to CDC to engage in some conversations. Can you talk a little bit about that and what you were hoping to achieve and what you think you were able to achieve at this point?
Well, I'll give you a little bit of background. My work with CDC initially had an adversarial approach. I filed legal petitions calling for an end to preferential treatment of the IDSA guidelines. And that is an example where advocates and patients could sign these petitions. And the one petition, and this is an example of some results, that 3 months after the petition was filed, a senior CDC official who was extending preferential treatment to the guidelines took early retirement. Another official dropped his membership in IDSA, and CDC removed the links to the IDSA guidelines from its websites. Now, I can't take credit for all of that, but I certainly had a role in that. And then I met the CDC people at an HHS tick-borne disease working group and realized they were not the enemy. I made friends with them. We talked about how we could work together to affect change. And I had some issues with some of the content on the website and was successful in getting them to correct that through administrative complaints. And they said, hey, why don't you come to us and let's talk about it? So a transition from an adversarial approach to collaboration, and it came full circle when they invited me to attend this meeting at CDC headquarters in March to develop questions related to the Pfizer VLA15 Lyme vaccine. So that's an example of transitioning, because you can only accomplish so much by airing grievances. And ultimately, you have to engage and really work with the other party to influence policies and practices. So I was
Yeah,
honored
that's
to
actually
attend
pretty
that meeting.
empowering.
Yeah.
Yeah. Yeah. No, that's good. I mean, I like what you just said also. A lot of times when you get down to the human level, right? It's when people have the ability to, this isn't really going to be the theme of this call, but when you get down to the human level, and I've heard people who say the same thing, that there's some amazing people at CDC who want to do the right thing, who want to enact change. There's just been some history that's made that a challenge. You've also done a lot of work. Just one quick thing before I bring on the next topic. And again, we're talking today with Bruce Fries. We're talking about advocacy, how you, as either a family member, partner, or friend, can be an advocacy for more Lyme awareness, for better diagnostics, for better treatment, for help with mental challenges related to Lyme, for so many things. I've met a lot of parents with teenagers of Lyme disease or even younger. And you did a lot of work with Mothers Against Lyme. So talk about that a little bit, and some of the work that they were up to and how you helped.
Well, early on in my career as an advocate, I noticed that Lyme disease seemed to impact women, especially pregnant women, and even their children. So that became an area of my focus. How do we advance research on the impact of Lyme disease during pregnancy and the long-term impact on the children who are infected in utero? So I organized a group to do a rally at NIH headquarters and set up a meeting to discuss how we could work with NIH to advance research on maternal fetal transmission of Lyme disease and pediatric Lyme. So this informal group became known as Mothers Against Lyme. Now, I'm not a mother, I helped get it going. So Mothers Against Lyme is now part of Project Lyme as a meetup group. But we reached out to NIH and set up a meeting with senior officials and research program managers to discuss how we could work with them to advance research. And this meeting, December 7th, 2020, was very significant because basically they said, there's not much they can do. The Lyme community needs to help get the word out because this is investigator-initiated research. And we're like, wait a minute, NIH needs to show some leadership here. What can you do? They can issue requests for grant applications, and actually they did that for some topics that we recommended. They issued a request for research on the impact of Lyme disease on the immune system during pregnancy. So at the end of that meeting, it was like, well, what's next? They said basically the Lyme community can help. So I organized a webinar titled Lyme Disease and Pregnancy, State of the Science and Opportunities for Research Support. And we went back to NIH, and we were dealing with two institutes, the National Institute of Allergy and Infectious Diseases, that's NIAID, and the National Institute for Child Health and Human Development. And we said, hey, we're doing our part. We're going to have this webinar to promote research. We want NIH to do its part and participate in this webinar. And the result was the first ever joint webinar between a Lyme advocacy organization and NIH. And we had a very good attendance from a lot of researchers and prestigious universities. And a year later, we actually got congressional recognition for this work through report language tied to NIH appropriation that commended NIH's collaboration with stakeholder organizations on maternal fetal transmission of Lyme disease. So to me, that was a big win because we raised awareness among the research community where it counts, and also among the NIH officials and program managers that were part of the webinar.
Wow, that was great. So again, we talked today with Bruce Fries. We talked about advocacy. Bruce, before I ask you about what people can do, it's just amazing that you've done so much, and how you've made an impact. I just want to acknowledge you for that. It's not everybody has, not everybody has said, I'm going to do something, right? There's plenty to be done. I've met so many people. Matter of fact, the very, very first podcast I ever did, I also do a sales podcast. I run a global association for sales leaders. So I have another podcast called the Sales Game Changers podcast. And this was August of 2021. I discovered that so many people who have gotten to a remission or recovery from Lyme created 501c3s or charitable organizations to do a whole bunch of things, but in many cases it was to raise some funds for people to get medicine or care or pay for doctor's appointments, whatever it might be. And I brought on three advocates, three people who had Lyme disease, people, just normal people who got Lyme disease, how most people do, obviously through a tick bite one day. And they went through this process and they created these organizations. And we talked about, having a mission-driven life to help you be successful in what you do. So I want to acknowledge you for taking this on, for taking on all these challenges, and it takes up a lot of time and energy. It's especially hard when you have Lyme sometimes, and you don't have the energy and things that you might be dealing with. So I just want to acknowledge what you've done and how you're going to be inspiring people through this particular show. So good for you. And thanks for all the things that I didn't know about until today's show that you had a role in. These are some various things that I've been aware of, but didn't know the history with some of them. So thanks for that. Is there any other things, without going into too much detail right now, as we come to the end of the Love, Hope, Lyme podcast, is there anything else that you're working on right now that maybe one more thing that you want to bring some attention to?
Well, nowadays my current project is working with the Senate Health Committee, that's Health, Education, Labor, and Pensions, to get them to hold a public hearing on health inequities associated with persistent/chronic Lyme disease. So we delivered a petition to Chairman Bernie Sanders several weeks ago, and there's a series of meetings over the next few weeks to talk to senators who serve on the committee and staffers to see what we can do to get this hearing. So that's an ongoing project. I'm also continuing engagement with CDC to develop a process where stakeholders can provide input and feedback on content to the website before the fact rather than after the fact. That's always been a sore point. We get things that change on CDC's website, we don't like them, but I'm reaching out and how can we work together to improve the content and do it in advance. And then another area I'm working on is the One Health initiative. And One Health is a very broad focus of the integration between human health, animal health, and the environment. And I co-organized a webinar, One Health for Tick-borne Diseases, linking human and veterinary medicine, that's going to air May 16th. It's sponsored by Project Lyme. So those are the current projects I'm working on. I don't
Good for you.
Always something to do. This is a marathon. It's not a sprint.
There's no shortage of things to do. Like I said, of course, we have a lot of the big organizations, and LymeDisease.org is a nice partner of our Love, Hope, Lyme podcast. And once a quarter, we do a show with Laura McNeil from the Global Lyme Alliance. And again, we've had Bonnie Crater on the show, and there's so many things that can be done, even anything. So to wrap up the show, just give us some advice. If you're listening to the show, you're a Lyme survivor, you're a family member of someone with Lyme disease, what would be your advice for them to do right now to add value to this world of chronic or persistent Lyme?
Well, first off, isolation is a key issue for many patients with chronic Lyme disease. So just being there, reaching out if you have a friend, relative, associate with has Lyme disease, call them up and say hello, talk to them, reach out and engage. because if you're sick, helping others just like, I did, can make you feel empowered as part of the healing process. And then also reaching out to your representatives in Congress and anytime, just send an email, call, because numbers, you don't have to wait till the Center for Lyme Action. You can send an email to your representatives in Congress anytime. So helping others and actively participating, especially with Congress, is something that really makes a difference.
All right. Once again, my name is Fred Diamond. This is the Love, Hope, Lyme podcast. I want to thank our guest, Bruce Fries. Again, thank you so much.